Let's stay with that issue. The National Institute of Communicable Diseases is launching an online respiratory health watch survey called Cough Watch SA. Let me just try and bring that information up here. The survey is set to monitor influenza-like sickness, with participants reporting their information on a weekly basis for 6 months during the flu season. Let's find out more. We're joined this afternoon by Mvuyo Makhasi. He is the study lead for Cough Watch SA at the NICD. Mvuyo, it's great to talk to you. Thanks very much indeed for coming on. So I've got the information in front of me here of exactly what this will entail, but essentially it's a group of volunteers who will form part of the study. It'll be for 6 months where they will report their symptoms to the NICD. That's one part of it.
That is correct. So we are looking for a cohort of volunteers that will form part of an online group that report the presence or absence of respiratory symptoms. So every week we send out a question on the platform to ask the participants who would have registered if they have had any respiratory symptoms in the previous week. If they have not, a simple no will suffice as a response. And if they do, there's a series of follow-up questions, such as the type of symptoms that they might have experienced, when the onset of those symptoms began, and then some health-seeking related questions around what type of care have they sought, what type of medications, and also if they've had a respiratory test for that week. So we can use the reported data to also compare with what we have from our Sentinel surveillance data.
Yeah, and then, so as we said, that's the first part of the study, and then the second part of it is the home-based part of the study, where I imagine you'll get one-on-one interaction with someone who's sort of in charge of the Cough Watch SA study.
That is correct. So what we have done is for volunteers on the platform who live in Johannesburg, Durban, or Cape Town will be invited to join this secondary study, which is the home-based testing, where once they access the link, they will provide a consent for some of their personal information to be documented. And then a testing kit will be delivered to their homes by our team, where they will take a nasal swab themselves, which will then be brought to our lab for PCR testing for influenza, for SARS-CoV-2, which causes COVID-19, and also a virus called respiratory syncytial virus, of which we then provide the results to the participants within 24 hours of receipt of the sample. The reason we're doing this is to increase testing capacity. We've seen during 2020 lockdown where there was a drastic decrease in the number of consultations for influenza-like related illnesses. And this has impacted one of our programs that we use to do seasonal influenza vaccine effectiveness. So by bringing testing closer to participants at the comfort of their home, we are hoping to achieve close to real-time detection of these viruses and also improve our capacity to confirm the viruses that are circulating within the community.
So you say close to real-time detection of these viruses. How does this help the NIC? How does this kind of information help the NIC and I suppose general practitioners around the country and doctors in hospitals, for example?
Yes, so it's an important question. So from a surveillance perspective, we do this in order to understand when is the onset of the flu season, right? When we start seeing an increase in the number of influenza-like related illnesses, from the NICD perspective, we are able to then issue out alerts about the onset of the flu season and encourage the public to seek seasonal influenza vaccination so that they can be protected either from illness or severe illness. So the timeliest communication of those alerts depend on the data that we obtain from our surveillance programs. So by having close to real-time detection, you get then data a lot earlier, which allows you to then plan and be able to respond effectively from the looming influenza season. From the perspective of care and the clinicians, if they can get close to real-time detection of these particular viruses, if a participant is feeling unwell, they are able to consult a medical practitioner and say, I've actually had a test through this program, here's my laboratory report. It might also assist the clinicians to provide the specific type of care because we now have a laboratory confirmation. So all of these, it benefits us from a planning perspective in terms of real-time data on confirmed cases, but also in terms of linkage to care. Participants can consult their medical care providers in order to seek the kind of resolve they require.
So, Mvuyo, you've mentioned flu, RSV, and COVID-19, that the study will also allow for participants to receive confirmation of those viruses, of those sicknesses, illnesses. Is there any part of the study as well that's interested in getting more information about tuberculosis in the country? It's still a leading cause in South Africa, TB. Is that also going to form part of what the study is watching out for?
So TB and more of your chronic kind of respiratory illnesses are not included in the study. From the NICD, we do have the Center for Tuberculosis that run ongoing surveillance programs, and even in our center, that is sentinel-based, based on patients who are presenting at medical care facilities, where we collect sputum samples that we then test and provide the results in order for the clinicians to link them to care. So this particular surveillance program is looking at acute respiratory symptoms. And for influenza-like illnesses, if you have symptoms that are within 10 days, we are able to use the combination of symptoms that are reported, such as a cough and a fever, and the symptom duration of 10 days, to indicate a suspected case for influenza-like illnesses. However, these platforms can be expanded to include other respiratory illnesses of interest, but TB, unfortunately, due to its chronic nature, is not part of the surveillance program, and we are only focusing on influenza-like illnesses.
Right. So the NICD is launching this survey, Cough Watch SA, this week. Do you already have the people who will form part of the study, or is part of the reason why you're doing this interview to find those participants?
So part of this interview precisely is for that, to really get the word out there into the population, to explain what the importance of the study is, and hopefully get them to sign up. So the study is launching officially this week. By tomorrow, then the press release statement will be issued so that the various media houses can have it, and participants can sign up as they receive the communication. But the website is www.coughwatchsa.org.za. Participants who are already interested in signing up can then access this URL, then create an account on this platform, and be part of the cohort that will be volunteering in this platform. What's also important to note is that we have enabled an additional feature for WhatsApp opt-in for participants who would prefer receiving the weekly symptoms notification on their WhatsApp. We've realized when we launched a pilot in the previous years that relying on email addresses had excluded quite a number of participants who either don't have email addresses, or even if they do, they don't frequently check their emails. And so by providing a WhatsApp opt-in, we are bringing the content closer, making it more accessible to participants, and therefore getting more data that allows us to provide more insights from what our volunteers report.